Irritable bowel syndrome, or IBS, is a fairly common affliction and easily treated. But sometimes when symptoms like diarrhea and flushing persist, it may be important to rule out less common conditions like neuroendocrine tumors, or NETs, a very rare form of cancer. Neuroendocrine tumors, also called carcinoid tumors, occur in about 5 out of every 100,000 people, men and women of all ages, and misdiagnosis is common. I'm Richard Olden for the NET Report. This series is designed to help you understand what NETs are, how to identify the symptoms, and most important, what to ask your doctor so you're diagnosed and treated early. In our first report, we asked a number of recognized experts, what are neuroendocrine tumors? In this report, we talked to both physicians and patients about possible misdiagnosis of NET and how to advocate for a thorough and accurate diagnosis. In coming segments, we'll look at the tests and information needed to diagnose NETs, how patients adapt to living with NETs, and how doctors in several specialties are involved in treating this serious condition. Dr. Eugene Woltering talked to us about how easily NETs can be misdiagnosed.
And then there are the physicians who are faced with patients who have unremitting diarrhea. They are often misdiagnosed for years as having irritable bowel syndrome. If you hear a hoofbeat, there's always a horse around. But occasionally, if you hear a hoofbeat, it's not a horse, it's a zebra. And that's what these neuroendocrine tumors are called, are the zebras of the tumor world. And the fact that they often their diagnosis will be triggered by a specific syndrome or a specific symptom. We have to teach more and more physicians that, listen for horses, listen for those hoofbeats. But when you see somebody with diarrhea, and it's the chronicity of the problem, it is the intensity of the problem, you have to think about IBS. But the other thing is say, okay, now, what if this is a neuroendocrine tumor? And you always have to have that suspicion in the back of your mind.
Patients have reported long histories of misdiagnosis before their NETs were detected.
My journey began in 1994. I began having severe abdominal pain and rectal bleeding. And I went from doctor to doctor doing colonoscopies and endoscopies. And they told me I had irritable bowel, ulcerative colitis, Crohn's disease, crazy, fatigue, and I needed more fiber in my diet.
I had been diagnosed with Crohn's disease in the early 90s and had been on a lot of medication for Crohn's disease for many years. And unfortunately, what that was doing was really masking all the symptoms of the tumors that were growing at that point, which we didn't know.
They said, take this type of medicines and stuff that will slow it down, which it did. Then it goes away for a few months and bango, it comes back again. This is going on for almost 10 years.
NETs are difficult to diagnose. Their symptoms are similar to other conditions like IBS. Other diseases can mask NET symptoms, and use of over-the-counter diarrhea treatments may control symptoms but fail to identify the underlying cause. This often delays accurate diagnosis, which requires the expertise of specialists. That's why NETs, on average, are not diagnosed for 5 to 7 years, which increases the probability of metastatic disease. About 40% of NET patients have advanced disease by the time it is diagnosed. Most family physicians aren't familiar with NETs because they are rare, which is why it's easy to mistake the symptoms as indicating more common conditions like IBS, gastroesophageal reflux disease, or GERD, menopause, or even anxiety. By the Rome criteria used for diagnosis of IBS, a patient must have abdominal pain and discomfort lasting at least 12 weeks, and at least 2 of these common signs and symptoms: a change in the frequency or consistency of stools, straining, urgency or a feeling that bowels do not empty completely, mucus in the stool, bloating or abdominal distension.
There's a wide variety of symptoms that someone with a neuroendocrine tumor can experience. They can range from very generalized symptoms like abdominal pain, nausea, even vomiting, to feeling unwell, to much more specific symptoms like flushing, multiple times a day often, diarrhea, wheezing, or what we call bronchospasm. If I was a patient and I presented with flushing, diarrhea, wheezing, or generalized abdominal pain, I would definitely ask my physician if they had thought about neuroendocrine cancer as part of a possible diagnosis.
In carcinoid tumors, sometimes and rather frequently, diarrhea is associated with flushing, which is this reddish color of the face and the upper part of the body, which might happen in different situations, such as anxiety, alcohol intake, and so on. And in this situation, of course, when you have both flushing and diarrhea, it's highly likely that you have a carcinoid syndrome and then a carcinoid tumor. I think that when a patient comes with symptoms, specific or suggestive, I would say, or even non-suggestive, everything leads to imaging. And these patients have, at some moment, at some point, for instance, an abdominal CT scan. On CT scan, there are many arguments to suspect the possibility of an endocrine tumor. So at that moment, I would say, the radiologist and all the specialists that see the patient have raised the possibility that this should be an NET and step forward to the next imaging procedure which is specific for NET, which is somatostatin receptor scintigraphy.
There are many signs, in fact, that could lead your physician to do thorough testing for NETs. New onset after age 50, weight loss, rectal bleeding, fever, nausea or recurrent vomiting, abdominal pain, especially if not completely relieved by a bowel movement, or diarrhea that is persistent or awakens the patient from sleep. We asked Dr. Eric Baudin what tests can be done to rule out a NET.
I would suggest that the first thing is that nearly all patients have a known diagnosis of neuroendocrine tumors at the time of measurement of chromogranin A. That's the first point. And in those patients, I think that we measure now CGA in all cases, as soon as we know that there is a neuroendocrine tumor in the patients and that this tumor is a well-differentiated endocrine tumors.
Depending on the type of neuroendocrine tumor, we may do anything from just routine imaging every 6 months to a year, or with a combination of biochemical markers such as chromogranin A or the urinary 5-HIA. In some patients, octreotide scans also may play a role.
In addition to accurate diagnosis, early diagnosis and treatment of NETs is also vital.
I think early diagnosis absolutely makes a difference. I think early diagnosis allows us to treat the tumor more aggressively and creates more options for the patient in terms of how to deal with the tumor.
What does it mean to have earlier diagnosis? Well, this is critical because the earlier we can diagnose these problems, the more likely we are to be able to cure them. And surgery is usually the definitive treatment for these tumors if we're fortunate enough to detect them early. So an astute physician who recognizes the symptoms that the patient is describing may be able to work with a surgical colleague and intervene surgically before the cancer has actually spread.
If there is a chance that IBS symptoms may be caused by a NET, what can a patient do to know for sure?
Taking charge of my own information and healthcare has been the single biggest thing that I've learned.
I tell people, if you have diarrhea a lot, the easiest test, you tell your doctor you want a 24-hour urine test, and this 24-hour urine test will show you if you have carcinoid. And don't let them say, we can't do it. Do it, because it's really your life. Get it done, and they could get it right away.
My messages today would be, You must be your own advocate. You must research your illness. You must look into things. If you're not happy with what one doctor says and you have any doubts at all, you go to another doctor. If you have any symptoms, you must be so attuned to whatever's going on in your body. I think it's so important that you really have to educate yourself as best you can about carcinoid, because unfortunately most of the doctors or internists that you see are not really familiar with it. They learn more from you than you actually learn from them.
If you have diarrhea or abdominal pain that either persists for a long time or is not adequately relieved by treatment, you should ask your doctor whether these symptoms could be due to a NET. Give the doctor a detailed and complete description of all the symptoms you are experiencing. The doctor will use this information to determine if a blood test should be done to rule out NET, or to refer you to an endocrinologist or gastroenterologist for evaluation. Our thanks to all the doctors and patients for giving us this insight into NET symptoms and the challenges of diagnosing this very rare form of cancer. For more information, go to the NET community website. It brings together people from around the world to enhance awareness, understanding, and management of this disease. Be sure to watch the other segments of this important series so you can be your own advocate. They cover what NETs are, the information needed to handle NETs, how patients adapt to living with NETs, and the multidisciplinary approach to treating this serious condition. This is Richard Olden for the NET Report.